Hope you had a good weekend. You're watching Monday's edition of COVID-19. I'm Min Sun Hee. The global tally has surpassed 50 million cases. While here in Korea, the daily count stands at the triple digits despite fewer tests conducted over the weekend. We have more on these latest developments later on, but here first is our Kwon So-ah with the numbers for this Monday. So to start us off with the events here on the local front.
Yes, Sunny. It looks like for weeks the nation is struggling to keep the COVID-19 cases below 100. We've been at above 100 for the second straight day, and it also looks to be difficult to keep the number of domestic transmissions below 100, as we have 99 reported this Monday with 27 imported cases. So the trend seems to be double digits, high double digits to the triple digits. And although we do have a decline here from Sunday, we always have to keep in mind that there are less tests conducted over the weekend. And if we take a look at last Monday, we do actually see an on-week rise. So it is no sign for relief as of yet with the 126 cases, which brings the total to 27,553. The death toll stands at 480 with 2 additional fatalities. And also people under treatment has surpassed 2,000. And if we take a look at where the new cases occurred this Monday, we have 46 in the capital, Seoul, 22 in Gyeonggi-do province, 2 in Incheon, which means in the metropolitan region alone, we have 70 new infections. And also a region of concern is here, Chungcheongnam-do province. Last week, we had an outbreak at a call center there, and this case is now becoming the number of secondary infections and tertiary infections looks to be growing here in this region. And quite a number of new infections were attributed to a lack of caution, including not wearing masks properly, while they are dubbed the best prevention method here in the country by many health experts. And beginning this Friday, citizens can actually be fined for not wearing masks in public, which is why the government decided over the weekend and announced that masks will be provided either for free or to buy in public spaces.
I see. So, and speaking of masks, I suppose we can expect a shift in COVID-19 prevention measures over in the U.S. under the new Biden administration.
Right, Sunny. He was one of the people, he was the one seen in the mask throughout the election campaigning. And yes, the fight against the pandemic is one of his top priorities. And given the urgency of tackling that challenge, he is set to announce the creation of a new task force on Monday. The president-elect in his victory address on the weekend said he will name a 12-member team that's to be comprised of scientists and experts that will be in charge of containing the virus beginning in January when Biden takes office. And he stressed no effort will be spared. Now, tougher measures are needed more than ever before in the U.S., which has become the first country to surpass 10 million cases as of Sunday. And it is also seeing some 100,000 cases on a daily average, as you can see here, still here on top. We are also seeing another surge in France, which now has more infections than Russia. Also, the death toll has surpassed 40,000 here, while Russia has over 30,000 fatalities. And if we move over to our next table, we see that Italy has now more cases than Peru, and a huge jump here in Poland. This has just recently joined this table of countries with the 20th highest infections around the world, now becoming the one with the 16th highest of numbers. So we really see that countries in Europe are seeing a much faster spread in many than in many other continents. So the resurgences in Europe as well as the continuing spread in the U.S. is contributing to grim milestones. We are seeing a record by record, and we have 50 million COVID-19 cases that were confirmed on Sunday. And in the past 30 days, around a quarter of the total figure was posted. It just took 21 days to get from 40 million to 50 million. And according to a Reuters tally, the latest 7-day average of daily infections around the globe stood at 540,000. And as of noon Korea time, we do have over 50.7 million cases around the globe, with a death toll at over 1.26 million and some 35.7 million recoveries. And those are the figures I have for now, but I'll be back with more domestic updates after our government briefing. Back to you, Sunny.
All right, so thank you for that. Back on the local front, Seoul city officials are seeking to better assist parents juggling work and childcare during the pandemic. We have details in this report.
It's after school, and children in elementary school are seen entering this building. This is the location of a public daycare center operated by the Seoul city government. Amid the COVID-19 pandemic, the daycare center has become ever so wary of maintaining good hygiene and preventive practices.
매일 청소, 소독, 환기는 기본이고요. 아이들이 센터에 들어오면 발열 체크와 손 소독, 손 씻기를 하고 있습니다. 그리고 외부인이 센터 내에 출입하는 것을 금지하고 있고요. 외부와의 접촉을 최소화하고 있습니다. 아이들도 독식할 때 이용료를 최소화해서 아동 간의 사회적 거리를 적정히 유지하면서 운영하고 있습니다.
일단은 큰 네모를 먼저 만들어 볼까? 커다란 네모 있지?
커다란 아이가 우리 되게 어렵게 만들어 놓았어.
The center was created to meet the daycare needs of young children with working parents.
선생님이 저쪽에 도착 지점에 가 있을게. 그러면 같이 따라와. 시작. 13초.
The center is now operating at extended hours amid the pandemic, ensuring that no child goes unattended.
지자체에서 직접 운영하는 곳이므로 그 아이를 믿고 맡길 수 있는 곳입니다. 그리고 저렴한 비용으로 이용할 수 있고 소득에 상관없이 돌봄이 필요한 아이라면 이용 가용하고요. 유익하고 재미있는 과학, 미술, 인성, 독서, 요리, 생일 파티, 민속놀이 등을 하고 있습니다. 그리고 소풍, 둘레길 걷기 등을 하면서 정서적 안정과 신체 발달 놀이를 충분히 할 수 있도록 지원하고 있습니다.
The daycare center provides many learning opportunities for the children, who also develop empathy by engaging in various activities with their peers. The center also provides daily physical activities for the children, which are especially important given the lengthy period of time that they're now spending indoors amid the pandemic.
센터 오니까 학교에서도 못 놀았는데 센터에서는 친구들이랑 많이 밖에서도 놀고 안에서도 노니까 매일 오는 게 기대돼요.
The center is also paying special attention to the children's diet by serving healthy and nutritious snacks. Night has fallen, and working moms begin arriving at the center to pick up their children. The daycare center has been a saving grace for many parents, trying to juggle the demands of work and childcare.
안녕히 가세요. 감사합니다. 일단 학교가 계속 개학이 연기가 되고 그렇게 되다 보니까 아이를 조부모님에게만 맡길 수 없는 상황이 되다 보고 조부모님도 이제 육아에 대한 피로함을 호소하시고 하다 보니까 그것이 제일 힘들었던 것 같아요. 아무래도 아이를 조금 믿고 맡길 수 있는 곳이 생겨서 그 부분이 무척 좋은 것 같아요.
After the children have left, the center gets ready for the following day by disinfecting the premises before closing its doors. Support from the community and the government is essential to relieve the burden of childcare from working parents. It is hoped that the Seoul Kium Daycare Center will be the first of many developments to ensure that parents are afforded the opportunity to pursue their careers and that their children are well taken care of at the same time.
It's a little after 2 in the afternoon here in Korea, and we are poised to join the regular government briefing on COVID-19. Now, it's been a while for Korea to note 3-digit numbers on a Monday, as fewer COVID-19 tests conducted during the weekend normally translates to lower numbers, normally the double digits, at the start of the work week. But today, Korea, as our Kwon-soa mentioned, recorded 126 cases from some 6,000 tests, and on Sunday, the country saw 143 cases from some 5,000 tests. Accordingly, Korea's rate of positivity for COVID-19 now stands at 2.5%. The briefing is about to start. We'll come back to you afterwards.
단장의 설명이 있겠습니다. 코로나19 감염증
Let us now begin our regular briefing on the domestic outbreak of the COVID-19 situation. And as of November 9th, we have a total of 99 new local infections and 27 new imported cases. Currently, the total caseload now stands at 27,553. And currently we have 2,044 people remaining in quarantine, and there are 57 patients with severe or critical conditions. And we had 2 additional fatalities, and the accumulated death toll now stands at 480. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now take a look at our update on major domestic infections by region. First of all, in relation to the building in Seochogu district in Seoul City, we have 3 additional cases being confirmed. In total, we have 16 cases to date. And in relation to an insurance company in Gangseogu district in Seoul, we have 8 more cases being confirmed. A total of 34 people have been confirmed to date. And in Gangnam-gu district, we have the Lucky Sana, and we have additional 2 cases being confirmed after November 5th, and we have 46 patients being confirmed in total. And in an alumni golf club in Yongin City, we have 2 additional cases being confirmed, and in total, we have 67 cases being confirmed to date. And in relation to the healthcare facility in Gunpo City and CARES facility in Anyang City, we have 6 additional patients being confirmed, and a total of 110 people have been confirmed to date. And in relation to a middle school and fitness center in the Seoul metropolitan area, we have 1 additional case being confirmed, and 2 total confirmed cases being confirmed, and a total of 71 cases have been confirmed to date. And in relation to a medical device sales center in Gangwon-do City, Gangwon-do Province, Wonju City, we also have a total of 16 cases being confirmed to date. And in Daegu City in Seogu District, in relation to the Daegu Jesus Central Church, we have 2 additional cases being confirmed, and a total of 37 have been confirmed to date. And in relation to a cafe in Daegu City, we also have the first index case being confirmed earlier this month, and a total of 9 people have been confirmed, additionally confirmed, and a total of 10 people have been confirmed to date. And in Changwon, Gyeongsangnam-do Province, in relation to a family gathering, we have 1 additional case, raising the total to 29. And in Jeollanam-do Province, in relation to the bank in Suncheon City, we also have 6 additional cases being confirmed, and a total of 7 people have been confirmed to date. And as for additional inquiries regarding other cluster infections, please make your inquiry to the spokesperson's office following the briefing. Currently, we will go through the COVID-19 outbreak in Korea as well as globally as well. And as of today, we are seeing a rapid surge of the COVID-19 globally. And in the U.S., daily, we are seeing more than 100,000 cases on every day. And also in Europe as well, we are seeing more than 300,000 cases being confirmed on a daily basis. And they account for about 68% of new domestic infections. And we also see many countries that are going through double of the on-day increase compared to this earlier this year. And this is this is believed to be because of the fatigued and loosened social conditions due to a prolonged outbreak, as well as the colder winter in the northern hemisphere. However, in Korea, compared to other countries as Europe and US, we are seeing a stable number. However, we cannot stay complacent as we continue to see sporadic outbreaks. And we are continuously witnessing cluster outbreaks, and we are also having sporadic outbreaks as well throughout the nation. And these are also leading to increase of the sources of unidentified infections as well. And therefore, this calls for our utmost effort to contain the virus. And this is why the quarantine authorities are looking into the massive preemptive testing at nursing hospitals and long-term care centers, especially in the metropolitan area and nationwide. And we will also provide full support to this end. And let me also go into the details a little bit further. Currently, we are seeing the influenza outbreak not as much higher than the previous years. However, when we see middle of November, we see a high increase of the influenza outbreaks as well. And this is why we are asking you to get yourself vaccinated with the flu shots. And also including influenza as well as other infectious diseases, especially respiratory diseases, it is very important that we wear face masks and also not touch our faces with contaminated hands as well. And abiding by such personal hygiene measures is also very important. And I would also like to highlight the fact that we have high risks of infection inside and indoor spaces, and it is also very crucial that you need to wear face masks when you are at indoors and when you are at crowded and confined and close contact environment. And of course, face mask wearing is not easy on a daily basis. However, before we have an effective vaccine being developed, it is the most effective measure to protect yourself. So please abide by these quarantine measures.
Right, there was Director Lee Sang-won with Monday's afternoon briefing. So what did he have to say?
Well, let's start with the major domestic outbreaks here in the country. We have new clusters, but also new infections related to existing clusters, especially in the metropolitan region, with 3 cases added to a case related to an office building in Seoul, with a total now at 16 there, and a golf meeting in Gyeonggi-do province, which we already talked about, I believe, 2 weeks ago. So that case now has a total of 67 cases with 2 added there, as well as medical facility related cases have been increasing as well, including in Gyeonggi-do province at one related to a facility in Anyang as well as Gunpo. And Lee also talked about the resurgences around the globe, as the US is posting some 100,000 cases on a daily basis, and Europe some 300,000 cases. So that accounts for almost 70% of the entire world. And this is also attributed to the winter season coming up, which is why Lee asked for the people here in Korea also to get ready for winter, meaning to get their flu shots and also wear their face masks properly. And this is especially important as we have a lot of senior patients at the moment, with 57 people currently in severe or critical condition. That number has also risen slightly from last week. In fact, today, the expanded massive screenings at medical facilities will start. Expanded meaning outside of the metropolitan region.
I see. Well, that is good to know. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, on the international front, today we turn to Brunei, where authorities have seen no new cases of COVID-19 since October 23rd, when the country noted an imported infection from Kuala Lumpur. I have Professor Mohammed Ayub Sadiq from the University Brunei Darussalam live on the line. Welcome, Professor Sadiq.
Thank you very much. Thank you.
Right,
Thank you,
Professor. Right. The country, Brunei, has a population of roughly 430,000, and the total number of COVID-19 infections there stands at 148, with only 3 fatalities since the first infection back in March. How were authorities there able to bring the virus under such effective control?
Yes. First of all, on behalf of University of Brunei Darussalam, we thank you very much for interviewing us. Yes, COVID-19 started in Brunei in March 9, and the government had taken very effective measures, and it had totally flattened the curve within a month. And the last local case was on May 6, so it is already 6 months. We have no local cases, but only 7 imported cases during the last 6 months. So it means about 1 important case in a month for the last 6 months. So at the end of May, Brunei had a series of de-escalation, easing the restriction to level 1 to level 4. We are now at the level 4. So we can have a gathering like a wedding, attending mosque, schooling, going to work, and so on. We just have a convocation in our university graduation ceremony a week ago, but of course still with a number of restrictions like maximum 350 people only for mass gathering, social distancing, hand washing, wearing masks, and so on. Restaurants, schools, gyms, all are open as usual. Situation is quite normal for the past 5 months, but we all take care all these precautions. It's all very important. So the effectiveness of these activities is a government preparation even before the COVID-19 reached to Brunei. There are a lot of resources need to be prepared, dedicated hospital, quarantine facilities, and so on. At the same time, testings are very aggressive. Of course, we follow the WHO guideline, and people are also well informed about social distancing, using masks and everything, high-risk group, and so on. Since before COVID started. But once COVID started, government immediately started restriction. No non-essential gathering, no mass prayers, mosques were closed, but it is not the really total lockdown. The restaurants are open for takeaway, supermarkets are open with all kinds of preventive measures. Yeah? And also COVID positive cases were effectively treated, aggressive contact tracing, a lot of testing and quarantine. And then that's a reason as well the curve was flattened within a month of outbreak. Yeah? And here I would like to stress, as you were asking, how is the effective measures? 4 important things in these measures. One is the leadership. The government as a team, not only health sector, all relevant ministry work together under the leadership of His Majesty Sultan of Brunei Darussalam. And number 2 is clear communication. I think you have it as well. Every day we had a press conference by ministers. They explained people the situation and the measure, and very transparent. They give the reason why we need to do this and that. And these 2 things lead to third important point. People trust on the government leadership. People fully cooperate. Yeah. And the final point, the 4th, is again people. Every single one, we need to have a sense of responsibility to do our part with proper understanding on the situation. I would say these are the 4 important points that lead us to success. Thank you.
I see. Professor, briefly speaking, what was the public response to these containment measures?
In fact, public follow all the government, guidance, the preventive measures like using PPE, mask, social distancing and everything. And then we also use kind of digital technology, mobile apps. Wherever we go, we have to log in and log out. And yes, these are the things that people follow very well to these activities. And when it comes to contact tracing as well, I think it is very much important that our people cooperate with all these procedures. Yes.
Professor Zadik, universities here in Korea and also elsewhere around the world opted for a blend of education methods using offline and online amid the pandemic. Tell us a bit about the learning approach at your university in light of the current times.
Yes, and during last semester, where we have a peak of crisis, which is from March to May, we do fully online. So all the lectures, tutorial, everything is online. And even that semester, the examination was done online. So we really managed to do it without any interruption for that period. And currently we are in a level 4 de-escalation. Because of that, we moved towards a blended learning. But this blended online and face-to-face combination, we call it structured blended learning, which is like we provide the learning material to students, online assignment, online discussion, and face-to-face, but we still have one face-to-face tutorial sections. That is because of our situation level 4. So this is going to be our new normal as well, we think, because blessing in disguise, this COVID-19 pushed us to a more innovative and creative way of teaching and learning. And we find it this, what you call structured blended learning is even more effective than what we did teaching before. Yes,
Professor,
that's our.
I see.
One more thing is even we managed to do a convo a week ago, which is a very blessing situation, I would say. Thank you.
I see. Professor, I'm also aware that there have been productive academic and cultural exchanges between your university and those here in Korea. Have such interactions been affected by the pandemic, or has the pandemic perhaps been able to broaden or perhaps diversify these exchanges?
Yes, I think, yes, it has effect to a certain extent, but at the same time, it gives us also a lot of positive development. And generally speaking, we have a bilateral collaboration with 26 Korean universities for the past 5 to 10 years. In our program, we call it Discovery Year. Our students have to go out from the university for a year, what we call it Discovery Year. And although they go all over the world, Korean universities are very popular among our students. We sent about 60 students in a semester, so altogether about 120 in a year. So we all have a similar number of Korean students as well in Brunei. And during March to May, the crisis time, because of COVID-19, our student came back to Brunei. The same thing, Korean student also went back to Korea. So we have a lot of meeting, discussion with Korean university to arrange our students to go back safely, to come back safely, and also Korean students to go back safely. And this, but after being back to own country as well, they continue online classes. So that's a really successful arrangement. But for this semester, unfortunately, we still have a travel restriction between countries, so including Korea. So this semester, no Korean students yet. But we have a series of discussion and meeting to have what we call it virtual student exchange. So again, that's what I mean by a new development that we are thinking how to move forward with this challenging situation. Hopefully, we will get this done next year. We hope to have students through this virtual student exchange. Another program we have is what we call it Global Discovery Program in Brunei. But now we are transforming to eGDP, e-Global Discovery Program, a kind of virtual or online things. So it seemed that the COVID-19 totally couldn't stop us. We will always find a way to collaborate and giving opportunity, the best opportunity to the students. Yeah. So in this global discovery programs, we introduce to Korean students like our popular Brunei culture, lifestyle, Brunei traditional food. They will see how to make all these food online and dancing, and also our Brunei places of interest and so on. So I think the same thing, it will happen for our students in Korea. So we really hope that collaboration still will be continue with what you call a different way or more innovative way.
Right, we'll keep our
Yes.
fingers crossed as well. All right, Professor Sadiq, thank you very much for making the time to join us live with your thoughts.
Yes. Thank you, Sunny. Thank you.
이러한 추세가 유지된다면 국내 환자 발생을 두 자릿수로 억제하고자 하는 관리 목표를 초과할 가능성이 커지고 있습니다.
Despite containment efforts by authorities, the rapid spread of the virus continues to challenge global health, and experts are now urging for greater support from the public to ensure better control of COVID-19. I have Dr. Alice Hyungyang Tan from Ms. Medi Women's Hospital. Good to have you back, Dr. Tan.
Thank you for having me.
And I also have Dr. David Kwok from Suncheonyak University Hospital. Good to have you back,
Good
Dr.
afternoon.
Kwok.
Thank you.
Dr. Tan, we'll start with you. Keeping in mind the latest trend here in Korea of three-digit numbers over a couple of days now, do you believe Korea's current standing under level 1 social distancing is appropriate?
I think for the time being, level 1 is appropriate. However, I did see some signs over the weekend that were a bit concerning. So first of all, the test positivity rate on Sunday was greater than 2%, and we like to keep this number 1% or lower if possible. We also saw a spike in the number of cases of unknown epidemiological link. That number went up by 26 cases Saturday on Sunday. And then the number of cases in the critical and severe category went up by 10%. This had been holding steady in the low 50s, and it went up from 53 to 58 such patients. And then lastly, of the daily new cases, the number of patients who are aged over 60 years old doubled from Saturday compared to Sunday. So Sunday compared to Saturday, the number went from 28 to 57. And I think that's the most concerning number for me because, of course, this is one of the criteria for maybe escalating to level 1.5. And this may, of course, translate into a higher death rate later on.
I see. And adding on to those concerns, Dr. Kwok, in recent days there have been a number of outbreaks outside of the metropolitan area, and quite a number of observers claim that such trends are likely to further challenge containment efforts by authorities here. What are your thoughts?
So I would like to share a couple of my personal experience through the past 2 weeks or so. Now I started to see a lot of leniency in people towards the virus. I want to emphasize that we need to be way more alert on the issues that the virus is still there and we're not off from it. And the world, if we saw the news, is actually peaking with their numbers, and it could possibly affect us in a way that there obviously will be an influx of those numbers into our country as well. One particular experience that I've noticed from the past weekend was that I was at a restaurant to take a certain food at a franchise restaurant. I was trying to pick up my food, and I noticed that it was jam-packed. There was actually people lining outside. And not only that, in their definition of keeping social distances within that restaurant, they actually blocked half off the whole floor and made people only sit in the half of the whole restaurant. That is not social distancing. You have to keep at least a meter or two away from each other on each desk, not put half the people in the half the place. So we have to be very vigilant in keeping the method and keeping the measurements on how to properly keep the social distances among people. And not only that, I think really I think we could use sort of a scare tactic in a situation like this. The growing numbers, it's not going to be transient because we're steadily seeing larger increments of growing numbers. It clearly shows that we have become way more lenient towards being alert towards the virus. We have to let people know there are still people dying from the disease. There are still people there are families actually being separated due to the virus, and then they see their family member die from the virus. There are cases currently going on in a situation like that. So we have to let people know that it is not over at all, and we have to be very careful with the virus.
Of course. Dr. Tan, about 10 days have passed since the Halloween celebrations here in the country. We have yet to hear, fortunately, about cluster infections arising from nightlife establishments during that particular time period. Are we safe then? Can we safely say that the Halloween celebrations were conducted in a safe manner?
Well, as you said, there are no specific links between the nightlife activity and clusters that we've identified. However, we have seen an increase in the number of sporadic cases from the community, and as I said, the number of cases of unknown epidemiological link has been steadily increasing, and this increase has been going on since late October. That's when this event happened, and yesterday we hit a new peak of 218 such cases. This is the highest number that we've seen in a month, and so this is a cause for concern. The worry is that we could have had asymptomatic carriers who are partygoers. They may have spread it then to other young, healthy people who subsequently don't have any symptoms. And then sporadic cases that we pick up in the community may be cases that are related to this nightlife activity, but several branches down the line along the chain of transmission, and so it's very difficult to link them. So we do need to be careful, and there are a couple more days until the latent period is over.
Right, that's true. Dr. Kwak, despite the relative containment of the virus here in this part of the world, elsewhere, especially in the US and in countries in Europe, the resurgence is frightening. I understand this would be a difficult question, but when do you suppose will this trend subside?
Well, I always like to refer to the graphs we brought up from Spain flu back in 1918. I always compare the current status of the numbers globally to the numbers we saw back in 1918. And because they had a very, very similar fashion, so possibly 2 or 3 different big waves hitting the globe, I think, so if we refer back to the 1918, they hit their peak around sometime mid-November. Their second wave also started from late September, like ours did, and then they peaked at mid-November, and then it started going off to not eradicate completely, but to minimalize sometime in December or so. So I hope that our numbers would definitely start to go down by the end of November, and would hope that also it would go down way below to secure ourselves some security sometimes after November or so. Another fact I want to mention is that some of the countries, a couple of countries and European countries, are also showing a very gradual decrease in the increments of increase in the numbers. So I'm not saying that they actually started going down, but they've slowed down in their increments. Also, a country like Spain, they saw a slight decrease in the daily cases numbers. So I'm hoping for the best that some of the countries in Europe would start to show a decrease in their numbers, showing us that it might be possible that we see the decrease in the total numbers globally. Another factor, I'm sorry for being long here, but I want to bring out here is that they had a comparison study back in between 2 different cities. One was in Philadelphia and one was in Missouri, St. Louis in Missouri. Philadelphia, because they were not prepared for the virus pandemic, they had a peak much like a city in China. They had a huge peak going up, and they had a massive number of deaths, and then they just gradually eradicated, and they were off from the virus. On the contrary, St. Louis were prepared for the virus. So they had a very gradual increase in their numbers, but they lagged on for a very, very long time. Meaning, if we don't come up with a cure for the disease, it's not likely that we're going to see 0 numbers. We're not going to see eradication of the virus unless we come up with a definite treatment regimen for this virus. So but it still means that if we keep the social distancing measure quite properly, like the city of St. Louis did, we are going to see much less of the deaths and much less of the fatality from the disease. So we should definitely keep the social distancing measures, but also I'm going to say that we also need to come up with some sort of a treatment method for this virus as well.
Right, definitely. Dr. Tan, the US, as of this past weekend, has more than 10 million cases. And what's really frightening is that the last 1 million was added on in a span of 10 days or so. Now, we have a new leadership poised to come into power in the US. Can we expect some form of control over the pandemic under the Biden administration?
I think that's what we're all hoping for. I think it's not an exaggeration to say that the global community has been waiting, really yearning for the United States, the most powerful country in the world, to muster the political will and the leadership that is necessary for tackling COVID-19. And that has just been lacking up until now. The problem is that I don't think the United States can afford to wait 2.5 months until Inauguration Day. As you just said, the disease is accelerating throughout the country. And it's quite frightening, actually, what we're seeing. I think the most critical differences that we can expect from the incoming administration compared to the outgoing administration is the messaging. As I said, that is the most important component. And then the translation of the message into leadership in action. There were so many points where the Trump administration was really counterproductive to what the rest of the nonpartisan federal government was trying to do. The CDC, FDA, NIAID, and the Department of Health and Human Services. They really were trying to get the country on track. But unfortunately, the words and actions of the Trump administration really were counterproductive, almost sabotaging those efforts. And so hopefully with the new administration, we'll be able to see the kind of dramatic change that is needed to see a turnaround in COVID-19.
Right. Dr. Kwak, let's shift our focus now to research for potential treatments. In one of Britain's latest trials, I understand aspirin, that common painkiller, is being studied. Can you tell us more about this?
Right, aspirin it has a great potential to be one of the treatment regimens for this virus because it's an anticoagulant and it's also anti-inflammatory. So it means that this particular virus was quite strange that it tended to cause coagulopathy in people that it was infected in, meaning people were having strokes, people were having myocardial infarctions from the disease, and so forth. Aspirin is already, well, it had been used for people who has had strokes before, so it would hopefully work in a certain way that it would block those coagulopathies and also would decrease the inflammation in people who are infected with the virus. Another factor I want to mention here, though, is that there are different time phases through the progress of infection of a virus that these medications need to be used in. As in the case of remdesivir, it won't be so much useful once people are starting to have cytokine storms, because cytokine storms apparently is not from a multiples or multitudes of virus, but rather it's a reaction to a virus infection already. So remdesivir would most properly be used at the beginning phase or replication phase rather than the inflammatory phase. That's in the case of a steroid. Dexamethasone, which is a strong steroid, had a very good effect in people who are having cytokine storms. So they were best used in people who are showing a very high inflammatory status, as opposed to in the beginning of the phase, it wasn't so useful. So with aspirin also, I'm hoping that the study will find out the appropriate time phase that it also needs to be used in.
Right. Professor Dunn, just out of curiosity, can you get COVID-19 through your eyes?
That's a very good question. So there was some research done. Scientists and researchers at Washington University in St. Louis, they tried to inoculate corneal tissue from the eye, this is donated tissue, with the SARS-CoV-2 virus. And what they found was the corneal tissue seemed to be resistant to the SARS-CoV-2 virus. But they did emphasize that their findings do not have any implications for the susceptibility of the tear ducts or the conjunctiva for the SARS-CoV-2 virus. And so according to their words, they said that it is important to respect what the virus is capable of and to continue to take appropriate precautions. In other words, healthcare workers still need to protect their eyes, and that is part of recommended PPE.
I see. Dr. Kwok, another study in the US showed a link between fine particle exposure and the risk of COVID-19 death. Could you tell us a bit about this as well?
Right, so this particular study, probably done by Harvard, if my memory is correct, they showed that they compared the fine dust map of the U.S. to the fatality rate of each counties of different states in the U.S. And they found that the states or counties that tended to have stronger fine dust and pollutions in the air would have higher rates of fatality. They actually calculated the number to be 11 percent point increase in the fatality per 1 micrograms per cubic meter. They're definitely trying to say that a larger the pollution is, the higher the fatality would be. There's also another study out of, I believe, Germany that had a very similar fashion in their result. Except if that was truly the case, we should have seen a great fatality rate in our own country and also neighboring countries that has a very high pollution rate. So I'm curious to know how that would affect in those countries that I particularly mentioned in Asia. But but in the end, there were analysis of the data. They were speculating that the pollution were affecting blood vessels and lung tissues to make them more vulnerable to the virus infection. So I guess a takeaway from their study is that we need to be more careful going out to the air pollution and fine dust in season like this.
Right, because we have had a couple of days with fine dust pollution in the air, right?
Very true.
All right, Dr. Kwok, thank you for your thoughts. And Dr. Tan, as always, thank you for being with us today.
Thank you.
Right, well, that ends our coverage of COVID-19 for this Monday. Do join us again tomorrow as we explore efforts to contain the pandemic under a new leadership over in the US. Do take care and thank you for watching. The South Korean government has resumed issuing discount coupons to revive the COVID-19 hit economy. They plan to start with sectors that can abide by the government's social distancing guidelines and then expand it to other sectors. Let's see how the government plans to balance disease prevention and economic activities as the pandemic protracts.
The government has resumed issuing discount coupons beginning with the culture and arts sector. It aims to support consumer spending on cultural goods and services while maintaining effective COVID-19 preventive measures. The coupons will first be distributed at facilities that can follow the preventive guidelines such as galleries, live performance, and movie theaters and sports facilities.
정부는 그간 제한을 받아왔던 국민 여러분의 문화와 여가 활동을 방역이 저해되지 않는 범위에서 조금이나마 지원해 드리고자 합니다.
On one condition,